Yes, thank you, Madam Chair. And I also want to thank Supervisor Horvath for also co-authoring this very important motion. You know, there are times when we have to put forward motions, but I can't think of how upsetting it is that we even have to do this today. But this action, I think, begs a question. We have to do something. The motion is one of those motions that I believe we have to take action. The motion directs the Probation Department to stop using OC spray on our youth, but more specifically, as a Probation Oversight Commission's report on OC spray, it showed to stop using OC spray on youth with developmental disabilities and girls and gender expansive youth. This isn't a new item for us. It's something that we know this board has addressed before. Previously, back in 2019, that was almost 4 years ago when this was brought up. And we had a different board at the time, but I think we were unanimous in our decision that we knew this had to stop. The board stood up for our youth who were incarcerated and said we didn't want to see any more use of it. We agreed with probation's request for a phase out, which came with training of staff, supposedly on de-escalation tactics. However, 4 years later now, we're not seeing an overall decrease in the use of OC spray. In fact, we're seeing an increase. And I want to thank our oversight entities like the POC and OIG who flagged the concerning use of OC spray to the board. In 2019, the board took action after an OIG report, and now I'm asking our colleagues that we take similar action after I have read, and I hope some of you have read or your staff had the POC report. Just within the reporting period from June to September of this year, the use of OC spray at Central Juvenile Hall doubled. Of the 232 OC spray deployments, 157 were deployed at Central Juvenile Hall, whereas 75 were deployed at Barry J. Norda, despite the lower population of incarcerated youth at Central. Of the OC spray deployments at Central, 60% of them occurred in housing units where girls were categorized as emotionally challenged girls, and boys who had been identified as developmentally disabled or regional center clients. I think all of us know what that means. The motion specifically directs probation to stop the use of OC spray at Central Juvenile Hall, which is in my district, and to stop it within 45 days in the units that house the youth that I just described. So I do think there's an overuse that is harmful to this population. It pains me to even say that we have to have our youngsters being sprayed because perhaps they are acting out or they have some other emotional conditions that I believe aren't being addressed appropriately. We know that many of them have already been harmed by trauma, and many things can trigger an emotional outburst by these young people. I also think it's a long time now for us to examine the effectiveness of the training and how staff are prepared. And I learned that the training staff used to get training from the regional center that is appropriately designated as a facility that can do this, especially for the developmentally disabled. But somehow, I guess during the pandemic, those training sessions stopped. I don't know why, but we need to find out. I'm also concerned that we haven't been keeping up in terms of providing data and oversight on these entities. And I don't know why that stopped. Even though the pandemic was here, we still should have continued to do that. The POC report stated that there were issues with the accuracy and validity of the data that was being submitted. So we need an oversight to see the oversight, in my opinion. In fact, the report states that they were provided varying and inconsistent data about who precisely has been sprayed, and including conflicting information about where youth were actually housed. Again, this is about our youth and who cares for them. And it also means our staff. If staff want to create those strong relationships with our youth, they're going to need to engage in a more trauma-informed manner. And we've always said that consistently on the board. The motion also intends to provide additional support for staff through the support of our newly created Department of Youth Development by authorizing their ability to expand the Credible Messenger program into the juvenile halls, starting with the one in my district, Central Juvenile Hall, and providing $2 million that has already been set aside in the DYD's budget to do this. We have heard and seen the effect of credible messengers. I think we all know that. And in Central Juvenile Hall, I have provided funding for the Anti-Recidivism Coalition that many of here know, ARC, to go inside and mentor our incarcerated youth. These services that they provide help give opportunity and hope to many of these young people who right now are devastated and don't even have enough programming, as we have heard, and some of our board members and our chair have even visited and saw that firstsight. And I understand that as well. I know at Barry J. Nordoff in Supervisor Horvath's district, you've also seen ARC and the Healing Dialogues in action also provide mentorship and services and have seen the impact that these credible messengers have on our young people. It's transformative in some ways. We all need at least one person, I think, who believes in us, and we want to make sure that these youth know that they have that support and that they can be successful as well. I think this is one of the most opportune times to provide that support that these youngsters need and to better engage our staff in probation to be more responsive and also receive the appropriate training and to make sure that they are adequately reporting the data as we know have been prescribed. So we are all looking, I believe, for a safer, wholesome environment and one where our young people can thrive. This has been a major problem for us for decades. And I thought we were going in the right direction, but given this report, it saddens me, Madam Chair, that we have to bring it forward. And I know my co-author wants to speak on this item, but I would respectfully ask for your aye vote.
Thank you, Supervisor Solis. You're the co-author, Supervisor Horvath.
Thank you, Madam Chair, and thank you, Supervisor Solis, for asking me to co-author this motion. I'd also like to thank the Probation Oversight Commission for answering the call to monitor progress on the elimination of OC spray and to keep the board informed of important developments. We are coming up on the 4-year mark since this board directed the Probation Department to eliminate the use of OC spray in all juvenile detention facilities. And in that time, there have been some positive steps forward. Within a year of the board's decision, the Probation Department eliminated the use of OC spray at all of its camp facilities. The Probation Department has made progress by updating its physical intervention policies and engaging labor in discussions around those policies. And the Probation Department has also updated its physical intervention training and has made progress in delivering this training to staff. Nevertheless, OC spray continues to be used at the county's 2 juvenile halls, and while the Probation Oversight's recent report points to less use at Barry J. Nydorf Juvenile Hall, which is in my district, less frequent is not what the board mandated. This board mandated complete and total elimination, and that is what we must continue to demand in both of our juvenile halls, especially given the vulnerable populations who have been most at risk. According to the Oversight Commission, OC spray is used disproportionately at Central Juvenile Hall in units that house some of the county's most vulnerable young people. It is unacceptable that 4 years after making a commitment to total elimination, this board is now forced to specifically demand that OC spray be eliminated in units that house vulnerable populations, as Supervisor Solis indicated, youth identified as developmentally disabled, girls, and gender-expansive youth. I'm also troubled that the Probation Oversight Commission's disclosure that the Probation Department provided varying and inconsistent data about which youth were housed in a given unit when OC spray was deployed, which makes it difficult for the Commission to make definitive conclusions about who is suffering most from the OC spray deployments. This board has placed its trust in the Commission to monitor this issue for us, but the Commission can't do that work with unreliable data. So today's motion calls for a fast-track plan to eliminate OC spray in units that house our most vulnerable young people. the collection of data that will enable the Probation Oversight Commission to engage in meaningful oversight, and support from credible messengers whose engagement with young people will undoubtedly lessen the number of incidents that lead to OC spray deployment. The motion also brings the Office of Inspector General in to partner with the Commission on oversight, and the Inspector General's analysis to confidential information will enable it to access and analyze data that looks beneath the surface to see if specific staff are over-relying on OC spray so that additional attention, training, and support can be provided at that level. I see this motion as a renewed focus on our board's directives from 4 years ago, and my expectation is that focusing on specific units within Central Juvenile Hall to collect data and incorporate the support of credible messengers will shed light on the most effective way to completely eliminate OC spray from both juvenile halls. I look forward to the reports back called for in today's motion as well. Thank you very much.
Thank you. Supervisor Mitchell.
Thank you very much, Madam Chair, and I'd like to thank the authors of this motion. I was in the state legislature when this body took this action, and it was carrying a package of juvenile justice right-sizing legislation, and so we were tracking this. And when I then joined the board and in my own onboarding efforts reviewed a number of past motions and was reminded about this motion. And so as I sit before us today and recognize that it's required that another motion be brought forward to take the same action, I just have to say it's frustrating just in terms of kind of the process. And so if I may, Madam Chair, I'd like to ask the Chief just a couple of questions to help me understand kind of why we are still here. So I guess my first question, Chief, if I may, is if you could tell us the current status of de-escalation training.
Madam Chair, members of the board, thank you for this opportunity, and thanks Supervisor Solis and Hartworth for bringing this motion forward. When I came in about a couple years ago now, February, it'll be 2 years, the OC spray was supposed to be eliminated. And through the state, there was legislation to try to eliminate OC spray throughout the state of California. So I know there was a big interest. And as mentioned previously, all the camps do not use OC spray. So when I came in, one of the things we noticed is that there was the pandemic, the training from the regional center was suspended. And I think that's something that's very important that we should be able to continue. And as far as the training, because of the pandemic, it slowed down all the hands-on training, all the in-person training. 2021, we started going to some virtual trainings. When we talk about this type of issues, we need to include not just the probation staff, but the credible messengers, and I'll take it one step further, including clinicians. I've been meeting with the interim director of behavioral health to see if we can get some clinicians. I went to Central last week and found out that they're looking into that possibility. I think it's very critical that we have clinicians also in the facility to de-escalate issues before they happen, not respond after it happens. So I think that's something that we're going to definitely need your support in getting our Department of Mental Health to provide clinicians. And I know it's tough, it's hard, it's difficult to hire clinicians. But the credible messengers, I also spoke to the interim director, Vincent Holmes, about getting credible messengers, and I was told that they may be able to have sometime in January to be able to assist us. Right now, the main focus has been at Camp Kilpatrick. Campus Kilpatrick, as you know, we moved some of the secure use track there, and we're trying to make that a success. We want to make sure that it's a model for the future. That is the LA model. And by having credible messengers with us is making a difference. We do have clinicians on site at Campus Kilpatrick, and I think that really helps us a lot. And as far as the training that we're providing, I think when we talk about trainers, we need to make sure that we continue with consistency in our training. Make sure that the staff are adequately prepared to continue with the training that we've been instructed to perform. Personally, I have not seen the training from the regional center, but if it was suspended, I want to know why, and I want to find out when can we reinstate that training, because it's critical that we have that training for all of our staff. And as you know, over 55% of our staff are females in the institutions. And it makes it sometimes challenging for our female officers, and I don't want them to resort just to OC spray. What I want to see is more engaging, and I think that's one thing we talked about. And if you look at the numbers on OC spray deployment since October, since we had your approval for the incentive pay, the use of OC spray has decreased between Central and Barry J. Norton since October when it started. We had 61 incidents of spray. And that's, when I talk about 61 kids have been sprayed, because in some cases you have multiple youths involved in a fight, and they use OC spray to try to contain those youths. When you try to separate them physically and it doesn't work, then you give the OC admonishment, you wait for them to respond, they still continue engaging, so we need to separate them, and that's one way of doing that. But we can tell that by having the additional staff, it has made a difference with the use of OC spray. And that's just a preliminary look at our numbers. Definitely we need to take a harder look. And when we talk about data that's inadequate, I think what we need to understand is sometimes youth get transferred and moved from one unit to another unit when they go to court, when they go to hospital runs, or when they come back. They're not always housed in the same identical unit. Sometimes they have to be shifted around for a variety of reasons. So when OC is deployed, you may see someone in one unit that was probably in a previous unit previous to the incident. So we try to contain that. One thing that I do talk about all the time is our technology. Our technology is so antiquated here that we need to make sure that we capture the information correctly, that we need to retrieve later. And when I met with Wyndon when we first met, is that I asked her that this is one of the areas where we need the most help. Our technology is so outdated, it's now 10 years behind where we should be. The legacy systems that we use are outdated. So it's hard to get her to capture the data that we want. Instead of going just paper and pencil, which is very complicated and more chances for error when you start doing paper and pencil data tracking. So I agree that we need to eliminate the OC spray. I thought it was going to be eliminated when I started. I learned that it was not. So now we're working on phasing it out. And working with our staff and working with the Department of Justice monitors as well, we've been coming out with a plan to stop issuing the OC spray to our academy classes, but there was a change. And we're going to continue with that policy, by the way, so we can phase it out going forward. I think the units that we talked about are the units that are very critical to us. I've been in those units. I talked to the kids. I talked to the girls, and they need more help, not less help.
Madam Chair, can I piggyback on your question, Supervisor Mitchell? You know, I'm really frustrated because I want to be able to hear from you when this is going to start. And I do want to know, I want more details also in terms of what kinds of incidents, how these youngsters, I mean, why were they being disciplined in this manner? And don't we have surveillance cameras? Are we looking at other tools that we have, I think, afforded probation to be placed there? I mean, are we really digging deep? Are we really taking this seriously? Because personally speaking, just describing the young girls and the young men that have developmental disabilities, and they're in our care, and I've been to Juvenile Hall East Lake, and I've seen them, and it's a small cohort. It's not a large cohort, so I'm wondering, you know, I understand they may be problematic for staff, but then that just begs the question, why are we not bringing in better staff who are better trained for that? And I think that is something that you need to take a handle on, because I would hate for us to go down this road again, and we are opening up ourselves for more liabilities. So, I mean, can you answer that, Chief?
I think a lot of the fights are multiple people fighting. It starts off, for example, one-on-one, and then other people join in. Some of the fights are gang-related. Some of the fights are racial-related, racial tensions-related, African Americans and the Hispanics. And that's what we see mostly at most of the issues. We do have cases where it's used on staff, and that's when they challenge the staff. I've been challenged a couple of times at Barry J. Norton for a fight, when the kid gets on my face and I just step back, try to de-escalate it, and another stuff comes in between us. I've been challenged at Camp Alphabach by a kid that wanted to fight because he didn't want to go home. He felt if he got a case on me, we want to keep him. And I told him, no, you're going home. You belong at home. So I have seen that, and I have experienced personally. But I think, like you mentioned, Supervisor, one of the things that we need to do is a better job is training the right people to come in there. One thing we're looking at, who can we bring in? What level of experience do we need in there? You know, most of our DSOs that come in are people that come off the streets. Maybe we need somebody who's a higher level of experience coming in. At night, we only require a high school diploma for our staff that works in the evenings. And the thing we're looking at too is what can we do to change our professionalism of our juvenile halls? Let's call it that. Let's make it a professional organization. And what would it look like going forward? There's a lot of moving parts when you talk about probation and everything that we're dealing with.
Thank
Supervisor Mitchell, reclaiming your time.
And thank you, Supervisor Solis. I agree with you. And as I listen to you, it's multiple populations. The motion speaks specifically to regional center eligible clients, girls, and gender expansive youth. To think that that population has a desperate experience with spray seems to me would almost, put us at ADA compliance. ADA is not just physical compliance, but, experience as well. So, it's two groups. And so this motion specifically talks about that group. I would hope that we would get to a point that all youth could experience a spray-free existence while they're in our facilities. So I hope we ultimately get there. But when we talk about the status of de-escalation training, it's across the board de-escalation, and in addition to that, training for our regional center eligible youth that is specific and nuanced. And so I'm assuming both forms of training ended because of COVID, and I hope as a result of this report back, we will hear about both forms of training coming back. The examples you cited in terms of being challenged, I'm not sure which population you're referring to, but it's clear that it's multiple populations that require some general de-escalation as well as some specialty training for our children who are regional center eligible. I don't know if the regional centers themselves are empowered to provide services to eligible clients while they're in juvenile hall. That might be something we want to consider to help augment your staff and to make sure that they're getting the kind of services they need. I look forward to this report back because I think us continuing to keep it on our own radar will help make sure that the youth in our care have a different experience. Again, I know it's going beyond today's motion, but I certainly hope we can get to a point where, as the state legislation was attempting to get to, that all facilities will be spray-free. Because, separate from LA County declaring our care first, jails last culture, it is just not in keeping with the more current research-based modes of facility management. It's just antiquated from my perspective. So I hope that we could just, being that we are a cutting-edge county, making sure that we are bringing cutting-edge resources to the youth in our care. Thank you, Madam Chair.
Thank you. Supervisor Barger, did you want to?
Yeah, I'm just going to be short. You made a comment that's got me a little concerned, Chief, and that is that you weren't aware that they discontinued the training. And I think my concern is that given, and by the way, ARC has been very good at highlighting when there are concerns. And when I hear them concerned about what's going on in the halls, then I know it's an all hands on deck. And the comment was twofold: training, but also centered around Campus Kilpatrick, getting some of those youth out to Campus Kilpatrick, because there are going to be individuals that are going to be problematic, and you have to separate, but you also have to train staff. And so you have a training unit, correct?
Yes.
So what is their excuse for not informing you that training has been discontinued? I mean, to me, because of COVID, if we can't send them to the regional center or whatever, then we should be bringing training into the camps or into the halls and into the camps, quite frankly, both. And so I would put your training unit on notice that this motion is the direct result of their failure to do their job. And I mean, I'm being harsh because I'm shocked that that was discontinued, because that could have prevented the rise in numbers. So I hope you as chief will let them know that that is unacceptable, to not have that type of training. Because I would argue, and correct me if I'm wrong, that the youth that we currently have that are housed have some sort of developmental disability that needs to be addressed, whether it be on the spectrum. I mean, so training should be just a no-brainer as it relates to working with the specific population. And I'd be curious to know your input on that, if you wouldn't mind.
Thank you, Supervisor Barger. And yes, I agree completely with the needs that the population presents. I know in doing our inspections, we found that at some of the facilities, sometimes up to 50% of the youth have IEPs, independent education plans, or in special education classes with LACO. They present with really serious diagnosed mental health, mental illness issues. They're under the treatment of therapists and doctors. Many of them have physical ailments. The Children's Data Network reported that approximately 80% have had contact with the child welfare system. We certainly are incarcerating a group of young people who present really tremendous needs. And I think the purpose of focusing that in this motion is twofold. One is that they're housed in individual units, the girls housed in individual units at Central, as well as the developmentally disabled unit, which makes it easier to target and track the progress on the phase out of OC spray, but also because of the tremendous need that presents. So the need of the young people is certainly a key in the not re-traumatizing and not engaging with them in a violent way that actually discourages their rehabilitation.
So, I mean, and I would say, Chief, in closing, and then I'll yield my time back, that training is ongoing. It never stops, ever. And, you know, I know within the mental evaluation team, the host teams, they're constantly training. And for lack of a better term, I don't want to say re-energizing, but re-emphasizing some of the way that you handle and de-escalate. So I'm hoping, you know, I'm going to support this motion. I'm 2019, and we moved forward and then we moved back. And I think my frustration also that it creates some angst amongst the union as well. And this really has nothing to do with the union per se. It has to do with training within the department, and the fact that we need to address that moving forward constantly, always updating the manuals, always looking at best practices, because there are best practices out there. And it may show us that moving the population like we did at Campus Kilpatrick or separating out certain individuals is a way of de-escalating, you know? So anyway, I just thought I would chime in on that. Thank you.
Thank you. Yeah.
I just to follow up on Supervisor Barger's questioning, I want to hear from the POC what your take is on the use of OC spray.
That's a very direct question, Supervisor Solis. My take on the use of OC spray is that the reason that I'm a broken record on this issue and that we brought it forth in this report is that I truly believe that probation staff can and do operate facilities without the use of OC spray. I have seen probation staff at the camps in particular where it's not an option, but also at the halls choose not to use their OC spray and de-escalate with fabulous levels of skill. I watched two young men get puffed up in an altercation in a classroom, and a DPO at one of our camps talk them into complete peace and conflict resolution where nobody got in trouble, there was no physical contact. They do have the skills. And I really believe that this is somewhat similar to what Supervisor Mitchell said. This is just it's an old, antiquated tactic that doesn't take into consideration the harm that it commits. It's a physical, violent intervention, and it's something that should be in our past.
Thank you, Madam Chair. Thank you.
Thank you. Chief, I think you've heard it. You know, how long have you been chief at our department?
A year and 10 months.
Okay. So I mean, we're not holding you responsible for what happened before you got here, but I think you heard from all 5 supervisors our frustration. Yeah, to think in 2019 we put forth the motion to phase it out, and I remember that board meeting very well. And who came down here was our probation officers, and they had signs that said we need training, and we agreed that it was a dual process: phase out OC spray, but you can't phase it out until you give the staff another tool. This is the only tool they've used for all these years to get control of what they feel is an out of control situation where their own safety feels threatened. This is all they've known. And we know that this board doesn't believe that anymore, but we also want to tell them that we are thinking about them and certainly our staff's safety and well-being. But there are other tools, there are other tactics to de-escalate. And it's very frustrating for us that that has not happened. We suspended a lot of things during the pandemic, but we kept a lot of things during the pandemic. And your department should have figured out how to keep this training going during the pandemic, because you can't have one without the other. I think we would agree. We can't phase it out until we give the staff something else to do to take control of a volatile situation. So it's very frustrating to us that you've used that excuse, or the department has used that excuse. Now, I think I think everyone's really upset. I think everybody's being really polite, Chief. I think Supervisor Barger's use of the word harsh was not really harsh. And I think you heard behind Supervisor Solis's very measured, polite comments a very angry feeling. And I think we're all feeling that. Come on, Chief. This is important to this board. It's important to those who are incarcerated, who are in our custody. It's important to the staff members. This is a priority. You have got to get this done. And we just are not in the mood to have any more excuses. It's important to us. So next time you come before us and this report, you better give us a direct, clear, timely pathway to how we can achieve the phasing out of OC spray. It's been done in other cities. It's been done in other probation departments. We've read about it. We've seen it. We need you to just really take this and make it happen. We're very frustrated, but we're being very polite today. So thank you. And thank you to Supervisor Solis and Horwath. I hate saying thank you for bringing it forward. I wish we aren't doing this as well. It's really troubling to us. Anybody else want to speak on this?
I just wanted to add, I heard in response to Supervisor Mitchell's comments that there was a decrease, and that might be the case in my district, but it certainly isn't at Central. That's why we brought this motion forward. And I want to make sure that that's on record, that we're very clear about what's happening and why we're taking this motion today, in addition to the direction that has been given in the past.
Thank you.